Next, I'm going to move on and palpate the temporal artery. I'm going to want to note the rate, rhythm, and quality, and everything appears to be normal there. I'm going to now do the temporal mandibular joint, and I'm going to aspirate and open her mouth. And this should be a smooth movement, which it was. And then I'm also going to do her sinuses. And when I palpate the sinuses, I'm going to want to note size, shape, location, consistency, and if there's any secretions coming from them. I'm going to do the frontal sinus and then the maxillary sinus, and all of that appear to be normal. Next, I'm going to do assess two cranial nerves. I'm going to start with cranial nerve number 5, which is the trigeminal nerve, and this is both a sensory and motor nerve. So I'm going to start by doing a pain and light touch test on her. And so I'm going to have her close her eyes, and this is going to be sharp and dull. I'm going to touch all around her face to see if she can detect this. Dull, sharp, dull, dull. And after that, I'm going to assess her lateral jaw movement. So I'm going to ask her to move her jaw from side to side, and this should be a smooth movement, which it is. And then I'm going to ask her to clench her jaw so I can assess the temporal and masseter muscles, and I should note the strength and consistency of these. And then also in cessation and when assessing this nerve, I want to make sure I do the corneal reflex test. I'm not going to be doing that for this assessment, but if I was, I would use a cotton tip and I would touch her cornea, and this would cause a blink reflex, which would be normal. Next, I'm going to move on to facial nerve, which is nerve number 7, and this is also a sensory and motor nerve. And for this nerve, I'm going to have her stick out her tongue and close her eyes, and I'm going to put a taste on the anterior 2/3 and have her identify it. Salt. And that would be correct. And then I'm also going to have her make facial expressions. So I'm going to have you raise your eyebrows, puff out your cheeks, smile, all of which was normal. Now I'm going to move on to assessing her neck, and her neck is erect and still, which is normal. Her sex is in the midline, and her accessory muscles are symmetrical on either side. I'm going to do a range of motion of her neck, so I'm going to have her look down, up, sideways, each way, and then touch your ear to your shoulder. Perfect, and all of which was normal. Now I'm going to assess her cranial nerve number 11, which is the accessory nerve, and this is going to test her sternocleidomastoid mastoid and her trapezius. So first I'm going to start with the sternocleidomastoid mastoid by having her move her head against my hand and this way, and then against my hands on her shoulders, and everything was normal there. I'm going to now assess her lymph nodes, and when I'm assessing a lymph node, I want to note the size, location, consistency, shape, and any delimitation that's associated with these. So I'm going to assess these bilaterally on each side. First, I'm going to start with the preauricle, the postauricle, the occipital, then I'm going to move to the submental, submandibular, tonsillar, and then down the deep cervical chain, and then the supraclavicular. And now I'm going to assess her trachea. I'm going to look first, and it doesn't appear to be deviating, it appears to be in the midline. Now I'm going to walk my fingers up on either side and just make sure that it is in the center, which it is. Next, I'm going to assess the thyroid gland. The thyroid gland, if it's enlarged, which is called a goiter, should not be palpated, and instead you should use the stethoscope to auscultate for bruits. But because it is not enlarged on patent, I'm going to palpate for it. So I'm first going to have her lean her head forward and slightly to the right. I'm going to deviate her trachea and then have her swallow. And it was non-palpable, which is a normal finding. I'm next going to assess her carotid pulses, and I'm going to do this on each side one at a time and compare the rate, rhythm, and quality, both of which are normal. And then I'm also going to assess for bruits. I'm going to have you exhale and hold it. Okay. And there we was no sign of bruise. And just jumping back up to lymph nodes, a normal lymph node would be non-tender. And next I'm going to move to the movements of the eyes, and this assesses cranial nerves 3, which is oculomotor, cranial nerve 4, which is trochlear, and cranial nerve number 6, which is abducens, and all of these are motor nerves. And so I'm going to start by doing the 6 cardinal fields of gaze, and I'm going to use my pen light to assess this. So I'm just going to have Peyton follow my pen where it moves. And she did all of that completely normally. And then I'm going to move on and I'm going to do the corneal light reflex. And so I'm going to shine my light of my pen light at the bridge of her nose and just have her look straight ahead. And there should be a symmetrical reflection on each side, which there was, which is completely normal. Now I'm going to move on and do the cover on cover test. So I'm going to use my eye chart again. I'm going to cover one eye for about 10 seconds. Make sure you're focusing just ahead of me. I'm going to remove it, and I should see her eye refocus, which I did. Smooth and clear, and I'm going to assess this by shining the light. And I can see that it's smooth and clear. And on all these eye tests, I'm only performing them on one side, but I would perform them bilaterally in a normal assessment. Then I'm going to assess the iris, which should be smooth and even in color, and it is. Now I'm going to move on and do PERLA, which is an acronym that stands for Pupils, Even, Round, Reaction to Light, and Accommodation. So I'm going to start by assessing her pupils, and they do appear to be round, and then I'm going to use the size on the side to indicate the size of her pupils. Hers are about a 3 on both sides, which is normal. A normal adult should have 3 to 5 millimeter pupils. Next, I'm going to do the reaction to light, and I'm going to shine my light and move it across her eye. And notice for constriction, and there should be a direct constriction in the eye that I shine the light on, and a consensual restriction in the opposing eye, which there was. I'm next going to do accommodation, so I'm going to have Peyton look directly at my pen light and follow it in. And I should see constriction of the pupils and convergence of the eyes, which I did. I'm next going to move on to assessing the ears. I'm first going to assess the ears externally and just make sure their size is proportional to the rest of the body and that their color is the same. And I'm going to assess this. I would assess this bilaterally, but I'm just going to stay on this side just for the sake of this assessment. And I'm also going to palpate for any tenderness. And there doesn't appear to be any tenderness or any lesions. I'm now going to look at, there is some cerumen, and that is completely normal. This is earwax, and that can be yellow in color. It can also be gray, brown, or black. And then it can be a waxy consistency, or it can be dry. I'm now going to begin by looking at the ear internally. And to do this, I'm going to hold my otoscope upside down, and I'm going to pull the peanut up and back and have her tilt her head downwards. I'm going to insert and look. And this is normal for an adult. And then for a child, I would want to hold the peanut and move it downwards just to straighten out their canal. As I looked at the external canal, which I wanted to make sure was not red and free of any lesions. There was no bleeding or any abnormality, and it wasn't swollen. And then I also looked at the tympanic membrane, which is a shiny pearly color, and that is completely normal. After performing that, I'm going to do the whisper test, which is for the acoustic nerve number 8, and this is sensory. So I'm going to stand about 2 feet behind her. I'm going to cover my mouth just to make sure there's no reflection in the room that she can see. I'm going to ask her to cover one ear, and I'm going to just whisper some words. 1, 2, 3. And then I'm going to ask her to cover the other ear. Cow. Dog. Squirrel. and she performed that completely normal. Now I'm going to move on to assessment of the nose. So I'm going to look at her nose, and I want to make sure it's symmetrical. There's no swelling or rashes present, which there isn't. And then if she expressed any concern about having a broken nose or pain, then I would just palpate it. And then I'm also going to test patency by having her occlude one nostril and then sniff. Can you breathe normally? And then I would do the same on the other side. And this would indicate obstruction. After I do that, I'm going to perform an test of the olfactory nerve. And this is nerve number 1, and it is a sensory nerve. So I'm going to have her close her eyes. I'm going to place a smell in front of her.
Alcohol.
Yes. Now I'm going to look.
Great, okay, I want you to go back as far as you can go. Okay, I'm gonna have you go ahead and bring your hand down to the table, and I want you to go towards your thumb as far as you can go. Bend your wrist. Okay, great. I want you to go towards your pinky as far as you can. Great. Okay, now I'm going to have you bring your elbow back into the table and make a fist with straight fingers like this. Great. Okay. Okay, I'm gonna have you bring your hand into more like a claw position like this. Thank you. Turn a little bit, thank you. Maybe turn your hand a little bit for me, thank you. Okay, I'm gonna have you bring your hand back down to the table. I'm going to stick this into your, on just to touch your palm of your hand. I want you to bring your finger up, touch it, and slide down to your palm. Okay, let's start with this finger. Good, okay. Now your middle finger. Good. Your ring finger. Good. Now your pinky. Perfect. Okay, so now we're gonna go ahead and measure your thumb. I'm gonna have you bring your hand flat to the table, and I want you to bring your thumb out from your fingers as far as you can go. Okay, great. Now I'm gonna have you bring it to its side. I want you to bring your thumb out as far as you can. Okay, now what I want you to do is I want you to bring your thumb in across your hand like this as far as you can go. Keeping it flat, good. Good. There we go. All right. Perfect. Now I want you to bring your thumb to your pinky finger, and then I want you to go and touch the top. I want you to bring your hand up towards yourself. Good. Now can you go towards your pinky side? Great. Hold it there. Don't let me move you. Good. Okay. Now just straighten to the middle, a little bit more towards your thumb if you can. Hold it there. Don't let me move you. Great. Okay. I want you to flip your hand over. I want you to bring the back of your hand towards yourself. Good. Hold it there. Don't let me move you. Good. Okay. I want you to lean forward for me. I'm going to tuck your elbow back a little bit. Perfect. I'm going to push here. Hold it there. Don't let me move you. Good. Okay. You can bring it back out. And go ahead and bring your wrist back up. Hold it there. Don't let me move you. Good. Okay, so the next thing I'm going to have you do is put your hand flat on the table like this. And I'm going to cover your fingers up one at a time, and I'm going to test one finger at a time. All right? Okay. I want you to bend your finger up for me. Good. Hold it there. Don't let me move it. Good. Okay. Go ahead and bend your finger up for me. Hold it there. Don't let me move it. Good. Bend this ring finger up for me. Okay. Hold it there. Don't let me move it. Good. Now, bend your pinky up for me. Hold it there. Don't let me move it. Good. Okay. You're going to do something similar. So you're going to lay your hand flat for me. I'm going to block right here. And I want you to bend this part of your finger up for me. Good. Hold it there. Don't let me move you. Good. Bend up for me. Hold it there. Don't let me move it. Good. Bend that one. Hold it there. Don't let me move you. Good. Hold it there. Don't let me move you. Good. I'm going to have you lay your hand, palm up, flat on the table, and bring just your fingers up. Perfect. Okay, I'm going to hold you here, and I'm going to one by one and pull your fingers back. Hold it there. Don't let me move you. Hold it there. Don't let me move you. Hold it there. Don't let me move you. And hold it there. Don't let me move you. Good. Okay. Next, I'm going to have you make it this hand again. Good. Okay. I'm going to go one by one. Hold it there. Don't let me move you. Hold it there. Don't let me move you. Hold it there. Don't let me move you. Hold it there. Don't. Great. Okay. I'm going to have you make this little longhorn sign like this. Hold it there. Don't let me move you. And hold it there. Don't let me move you. Can you bring your hand flat to the table like this? And you spread your fingers apart as far as you can. Great. Now can you bring your index finger as close to your thumb as you can? Good. Hold it there. Don't let me move it. Good. Can you bring your middle finger towards your index? Good. Hold it there. Don't let me move it. Okay. Bring it back this way for me. Good. Hold it there. Don't let me move it. Good. Now this last finger, bring it out for me. Hold it there. Don't let me move you. Good. Okay. I'm going to bring your hand up like this. I'm going to do these 3 fingers. Can you bring them close together? Okay. Hold it there. Don't let me move it. Hold them tight together for me. Okay. Hold it there. Don't let me move it. This last one. Hold it there. Don't let me move it. We're going to do just a couple more things with your pinky. Now you have your hand with your palm up. Go ahead and bend your pinky up for me. Hold it there. Don't let me move it. Good. Okay. I'm going to flip your hand over with your fingers together. You're going to bring your pinky out. Good. Okay. Hold it there. Don't let me move it. Awesome. Okay. I'm going to have you bring your pinky up to your thumb. Touch them together like this. Okay. Can you bring your elbow up to the table? Perfect. Okay. I'm going to stabilize you here. Hold it there. Don't let me move it. Good. Okay, now we're going to do some stuff with your thumb. First thing I'm going to do is bring your thumb up like this and bend it. Perfect. Okay. Hold it there. Don't let me move it. Good. Okay. I'm going to bring your hand down into your palm like this. Good. Hold it there. Don't let me move it. Good. Okay. I'm going to bring your thumb back up. Good. Hold it there. Don't let me move it. Good. Okay. Keep it there. Hold it there, don't let me move it. All right, I'm gonna have you bring your hand up like this. Keep your fingers close together for me. I'm gonna pull here, hold it there, don't let me move you. Good, all right. You're gonna bring your palm down on the table. Bring your thumb out. Good. Hold it there, don't let me move you. Good. Now with your palm up, your thumb straight in the air. Awesome. Hold it there, don't let me move you. Good. Now just bring your hand up, your elbow up to the table for me. Once you bring your thumb to your pinky. Good. I'm gonna hold you here, hold it there. I'm gonna have my hand here so I can palpate your muscles and feel them working. I want you to bend your hand in towards yourself. Good, okay, hold it there. Don't let me move it. Good, okay, keep it bent. All right, good. Hold it there, don't let me move it. Good, okay, relax. Now I'm gonna do the same thing, except you're gonna bring your hand backwards out towards you. Good, okay. Hold it there, don't let me move it. Good, okay. Go ahead and keep your hand out like this. Hold it there, don't let me move it. Good, okay, now I'm gonna have you lean forward for me. I'm gonna tuck your elbow back some. Good, keep your elbow or wrist out. Hold it there, don't let me move it.
Good morning, I'm Caitlin. I'm going to be your NP for the day. Let me just wash my hands.
Okay.
Nice to meet you.
Nice to meet you.
So we're going to be doing a musculoskeletal and a neuro exam today. So we're first going to start. I'm just going to look at your upper extremities. So I'm going to palpate your joints. They have normal color, normal stability, any pain, no tenderness.
Nope.
No pain, no tenderness. I'm going to look at your deep tendon reflexes. So I'm going to start with your triceps. Perfect. Your biceps. And then your brachial valves. Perfect, so those are all intact. We're gonna look at her strength next. So hold your hands up like this, pull against me, perfect, push against me. So her strength is intact, 5 out of 5. Next, we're going to look at her shoulders. So I'm going to palpate your clavicle, your acromion process, and your head of your humerus. So I don't see any tenderness, swelling, masses, anything like that out of the ordinary there. I'm gonna have you lift your arms up for me, go up behind, go down, go back. So, and then out, and then in. So abduction, adduction, internal rotation, external rotation, all intact. I'm gonna have you hold your arms straight down in front of you and slowly drop them. Perfect. So negative for drop arm test, and that would be if she had like a rotator cuff tear. Next, we're gonna look at her elbow. So I'm gonna palpate here, see if we notice any redness, tenderness, swelling, the olecranon process, the lateral and medial epicondyle, and ulnar nerve. And I don't feel anything out of the ordinary. No pain or tenderness. Okay, so no pain, no tenderness, no swelling. I'm gonna have you go like this, perfect. Flexion, extension, and then I'm gonna do supination, pronation, perfect. Those are all intact. And next we're going to move on to her wrists and her hands. So I'm going to have you, you can hold your hands like this, perfect. So I'm going to have you go up and down and in and out. So flexion, extension, ulnar deviation, radial deviation intact. Squeeze my hands for me, perfect. I'm going to have you hold your hands in a, yep, just like that. So I'm going to check for, this is Fallon's test. So I'm going to push her hands against, and I would do this for 90 seconds. And if she has any numbness or tingling, that would relay that she might have carpal tunnel. So negative, no numbness, no tingling there, correct? No. So negative for Fallon's, and then Tino's, I'm going to tap right here. And if she has any tingling or numbness, that would also say that she has carpal tunnels. Next, we're going to have her, we're going to test her proprioception. So I'm going to have you touch your fingers to your nose, and then I'll have you do it while you close your eyes. So proprioception is intact. I'm going to have you check for kinesthesia, which is where you take your thumb and touch your fingers. Perfect, so kinesthesia is intact. I'm going to have you close your eyes. I'm going to get an object, and I'm going to put it in your hand, and I want you to tell me what the object is, okay? So there you go. It's a pen. Perfect. So proprioception is intact. And then I'm going to check for graphesthesia. I'm gonna also have you keep your eyes closed, and I'm gonna write a number on her hand, or number or an object, but this will be a number, so let me know what number it is.
3.
Perfect. So graphesthesia is also intact. And then the last test, I don't have what we would use to test it, but it would be a circular object and it would have 2 points on it. And I would ask her to just make sure that she could feel the 2 points on there. So that would probably be intact also. Next, we're going to move on to her lower extremity. So I'm just going to palpate. Is it okay if I touch you? Okay. I'm going to palpate for her, like make sure that the joints are all same color, same temperature. I don't feel any redness, swelling, tenderness, edema, anything like that. I'm going to have you stand up, and I'm going to have her look at you, close her eyes, and hold her hands out like this. And this is going to check for Romberg's. So if she swayed or started to fall, that would be positive, but she has negative Romberg's. I'm going to have her hold her hands up like this, and this will check for pronator, so if her arm was to drift. So obviously she doesn't have any problems, so no negative for pronator. I'm also going to have you sit back down, sorry, and I'm going to palpate and have you push against me for your muscle strength. So push against me, pull against me, push against me, perfect. So her strength is 5 out of 5 for her lower extremities. And I'm going to have you lay back. I'm going to help you lay back. And it's okay if I lift your shirt up? Okay, so I'm going to test for her abdominal reflux. So, perfect. And I can see her her body twitches, and I can see it moving. So that's positive for abdominal reflux. Perfect. We're also going to look at her back. So I'll have you stand up and face this way so it's easier for everyone to see. So just looking at her head looks symmetrical with her body. I don't see any bending or like she looks like she has any back problems, but then we'll also palpate and feel. And then I'm going to have you bend forward. Perfect. So her flexion is intact with that. I'm going to feel, I don't like palpate her spine. I don't see any kyphosis or scoliosis. I'm going to have you back up so the extension is intact. Perfect. And then I'm going to have you rotate from side to side. So rotation is also intact. While you're standing, I'm going to look at your hips. So I'm going to palpate for the superior, posterior or anterior superior iliac spine, her posterior superior iliac spine, her greater trochanter, and then her iliac crest. And those are all, they all feel fine. They don't look swollen, redness, edema, anything like that. I'm going to have you stand straight. I'm going to have you lift one leg up. So this is a Trendelenburg's test, and that's negative. So if she was to fall, that would show that. I'm going to have you lay down on our table again, and I'm going to do the straight leg test. So I'm going to lift your leg up, and you just let me know if you have any back pain.
Nope.
Perfect. Other leg. So this is testing for if she would have any like herniated discs, she would have lower back pain. So that was negative for lower back pain. Next, we're going to look at her knees. So I'm going to palpate the femur, the patella, and the knee. So I don't feel any redness, swelling, tenderness. They're bilateral. I'm going to have her, I'm going to check for the ACL tear. So I'm going to have you lay down. I'm sorry, this is a lot of like switching, but normally it's not as fun. So I'm going to do the drawer test, and I will, what I would do for this is put the patient at 90 and then see if I can feel any tears. So no pain, no tenderness. I would do it the same the other knee, but for saving time, I won't do that. So that would show me if I felt any movement or clicking, popping, that would show that she had an ACL tear. And then I'm also going to take your foot and roll it down the side. So this is testing for coordination. Take it the other one. Perfect, down her shin. So she can do that, and that shows that her coordination is intact. We're going to look at her ankle and feet. So I'm going to have you sit back up. Okay. I'm going to look at your, I'm going to palpate your ankle and feet. So I'm palpating for the lateral malleolus, the medial malleolus, the tarsals, and then the metatarsals. So no pain, no tenderness, no swelling. They both seem fine bilateral. I'm going to have you pull against me, push against me. Perfect. And then I'm going to have you go up, go down, go out, go in. So her range of motion is intact. I'm going to also look at your Achilles tendon. So first of all, I'll just look at your reflexes. So her Achilles tendon is intact, and then her patellar reflex. Perfect. So her deep tendon reflexes are intact. I'm going to have you lay on your stomach on our table, and I'm going to test for Achilles tendon tear. So I'll hold up, and so I'll squeeze her calf, and you should be able to see it move just like that. I would do it with both legs. Let's do this one, and that would show that her Achilles tendon does not have a tear. So, and then we're also going to look at her plantar flexion, or reflex, sorry, and so you can see her foot move, and that shows that her plantar reflex is also intact and working.